You're listening to an African Elements top news story for April 8th, 2025. Please visit our website at africanelements.org for more daily news. Black women AGs, Trump admin, public health, Project 2025 Black AGs. Trump legal challenges face scrutiny. By Darius Spearman, Black women attorneys general, AGs, stand at the forefront of significant legal battles involving former President Donald Trump. AGs serve as the chief legal officers for their states or the federal government. They hold the responsibility of enforcing laws and representing government interests. In New York, Attorney General Letitia James is pursuing a massive $250 million business fraud lawsuit. This suit alleges that Donald Trump and his family deliberately inflated asset values to deceive lenders. Such actions highlight a focus on accountability for powerful figures. Meanwhile, in Georgia, Fulton County District Attorney Fani Willis leads another high-profile investigation. Her office examines Trump's alleged interference in the state's 2020 presidential election results. Potential criminal charges are reportedly under careful consideration. These legal challenges underscore the significant role these prosecutors play in upholding electoral integrity. Consequently, both James and Willis have faced intense personal and professional attacks from Trump. These attacks include racist smear campaigns and efforts aimed at undermining their legal authority. The previous Trump administration implemented policies that severely cut federal funding for vital women's health research. These cuts halted studies on conditions like uterine fibroids, pregnancy risks, and Alzheimer's care. Uterine fibroids, non-cancerous uterine growths linked to significant health issues, affect a large percentage of women. While 77% of women are affected, it doesn't specify if this figure refers specifically to Black women, despite the condition disproportionately impacting our community. Furthermore, reductions in the research workforce at the National Institutes of Health, NIH, compounded the problem. The NIH, a key federal agency funding medical research, faced potential reforms under conservative proposals that could sideline specific studies. The elimination of terms like women and trans in funding language also threatened decades of progress in understanding sex-specific health conditions. These actions exacerbate existing health disparities, particularly for Black women who already face pregnancy-related mortality rates 3 times higher than other groups. Their reproductive health access has also been targeted through policies like South Carolina's attempts to ban Medicaid funding for certain providers. Looking ahead, initiatives like Project 2025 signal potentially worsening conditions. Project 2025 is a comprehensive plan developed by the Heritage Foundation and allies. It aims to prepare for a potential new Trump administration by outlining conservative policy implementations. Its goals include consolidating executive power, restructuring federal agencies by replacing civil servants with political loyalists, and advancing socially conservative agendas. The plan specifically targets reproductive health care protections and access to programs like Medicaid, which would disproportionately harm Black women and low-income communities. Moreover, Project 2025 proposes dismantling essential support systems. This includes eliminating programs like Head Start, which provides crucial nutrition and child care for low-income families, and making deep cuts to the SNAP food stamp budget. These changes would likely worsen food insecurity and restrict health care access, particularly impacting Black women and children. Concurrently, Trump's 2024 campaign includes pledges to erase diversity, equity, and inclusion (DEI) programs. DEI refers to policies designed to promote fairness and representation for marginalized groups. The campaign aims to criminalize anti-discrimination training and reinterpret civil rights laws, potentially rolling back protections for these groups. Eliminating DEI initiatives and cutting funds for anti-discrimination offices could normalize biased practices within institutions. The impact of these policies and political climates creates unique barriers for Black women in various fields. For instance, researchers like Daniela Federa, who studied uterine fibroids, experienced funding termination under Trump administration cuts. This forced her to seek opportunities internationally, illustrating a potential brain drain, the loss of skilled professionals, from American science. While the term brain drain describes this phenomenon, specific data on its extent within this context is not available. Furthermore, Trump has a documented history of using racialized rhetoric specifically targeting Black women in positions of power, like Representative Maxine Waters and Vice President Kamala Harris. These attacks reflect broader patterns of systemic disempowerment. Systemic disempowerment refers to how institutional rules, practices and resource allocation can marginalize specific groups. Proposals within Project 2025, such as gutting agencies like Housing and Urban Development (HUD) or altering the Department of Homeland Security (DHS), could further embed these patterns, making it harder for marginalized communities to access resources and protections. Consequently, the combination of targeted rhetoric, policy changes affecting health and research, and plans to dismantle equity initiatives creates a challenging environment for Black women's advancement and well-being. Copyright African Elements.